Hello, I am Dr. Harpreet Gilhotra, Director Cardiology, Sohana Hospital, Mohali. Hypertension is completely asymptomatic. Human beings cannot sense their blood pressure. When we run, the blood pressure goes up to 200 or so. But at that time, we do not feel any headache, any dizziness, giddiness, or heaviness of head. So, blood pressure cannot be sensed by human beings. It is only to be recorded and accordingly treated. If the home blood pressure readings are persistently more than 135/85, they should be reported to the consultant and that blood pressure should be treated. Blood pressure is completely asymptomatic, and how to measure blood pressure, it is very important. Person has to be in resting condition, should not have taken tea or coffee at least 1 hour prior, and should have passed urine. There should not be a painful bladder. Any pain, any anxiety will increase the blood pressure by 10 to 20 millimeter of mercury, so the readings will be false. So the best time to record blood pressure is in the morning, once patient has passed urine, before taking bed tea, or prior to dinner. And when measuring blood pressure, it should be in sitting posture. Legs should be resting on floor and arm should be resting on table. So in resting condition, whatever the blood pressure readings are, they are correct, and one can use a mercury manometer. It's though it is now outdated, and for the next generation it may not be available. So for home blood pressure monitoring, patients can use automated machines. Most of them are accurate, which are to be applied on the upper arm. The machines which are to be applied on finger, their accuracy, I would say, is not that great. CT angiography is to decide whether conventional angiography is needed or not in intermediate risk population. There are patients where you do not intend to do angiography, and then there are patients where you plan a definite angiography because you need to decide the treatment plan, whether patient is good for only medical treatment or requires angioplasty or bypass surgery. Where this decision is very, very important, there conventional angiography is to be done. CT angiography is to be done in intermediate risk patients where you are not sure whether this patient should be subjected for angiography or not. CT angiography is not same as standard coronary angiography. Heart is a moving structure. It is not possible to image the heart in a single beat or in a fraction of second. So multiple beats are taken, and then with the help of ECG gating at specific RR interval, we pick up the multiple images. And whatever beautiful diagrams you see of the heart and coronary in CT coronary angiography, they are actually computer graphics. So their sensitivity and specificity is close to 90% but not 100% compared to standard angiography. Whatever is best for the patient is better. So it is not the modality of treatment but the patient who should be our center of focus. Medical treatment is to be given lifelong if there is a coronary artery disease. Regarding angioplasty or bypass, most of the patients, if they survive long enough, probably will require both. If angioplasty fails, bypass; if bypass fails, a repeat angioplasty. So this decision is to be taken along with cardiac surgeon, cardiac anesthetist and cardiologist, that at this given point of time, which procedure is better for the patient, whether angioplasty or bypass. Cervical spondylitis and giddiness is a complete myth. It is anatomically not possible for cervical spondylitis to produce giddiness. Giddiness, there are two most important causes, the cardiac and neurological causes of giddiness. Neurological cause is vertigo, where there is a feeling of rotation, and in cardiac cause, it is happening because heart is not able to supply appropriate amount of blood to the brain, so there is a blackout. So But otherwise, cervical spondylitis, anatomically it is impossible to produce giddiness with cervical spondylitis. Find out whether it is the increased, the tachyarrhythmias, increased heart rates, which are producing low output state, or it is the decreased heart rate or the bradyarrhythmias which are producing this state. So if there is a bradyarrhythmia, patient requires a pacemaker. If it is tachyarrhythmia, patient requires AICD implantation, which is just like pacemaker but can give shock if need be.